What's up, y'all? It's Dr. David Roney. I hope everybody's doing well. Just parked, man. It is day 27 of 31. We're rocking it, man. We're rocking it. Looked at my analytics this morning and it was 486, which means we're 14 views off of the 500 target. And again, this is, I set a goal to get 500 views on this channel. We basically started at 0 in the month of May. And we're almost there, and I'm posting every day, and we're rocking it, man. Today's topic is health insurance, like choosing a health insurance plan. All right, so a lot of people get confused about health insurance. The reality is health insurance fucking sucks. Health insurance is mandatory, right? Everyone has their sort of problems with health insurance. You should, right? The insurance industrial complex essentially amounts to a Ponzi scheme, because, you know, insurance, like, the whole goal is for it not to, the company to pay out right away. They need to delay the payment, and healthy people sort of subsidize those who need to use the sort of healthcare industry more than others. But no matter what, it's mandatory that you have health insurance. You don't want to wind up really without health insurance in our country, because health care is very expensive. So how do you choose the correct health insurance plan? Well, I mean, it's a pretty simple decision tree, right? The first question you got to ask yourself is, how often do you use the health insurance or health care system? If you anticipate using the health insurance a lot, well, I mean, save yourself some money and get a low deductible plan. Now, a deductible, you can think of that as the hurdle that you must hit, the amount of money you must put into the plan before the insurance sort of takes over all of it. Now, high deductible plans, I tell people to get those. So high deductible plans are typically plans that are going to have a lower monthly premium, and low deductible plans are going to have a higher monthly premium. That's what you're paying every month to the insurance company. Now, low deductible plans are better for people who, again, you anticipate that you're going to need the health. So you want health insurance company to kick in more, like, quicker, right? Now, health insurance doesn't pay for everything, right? Like, you got to opt in to certain coverages. If you know you're going to have a baby in the next year, you need to opt into the obstetrical care, specifically like labor and delivery, because they tend to charge a crap ton for C-sections and the healthcare stay afterwards. So you got to know what you're doing. Now, the ridiculous thing about our system is that, like, vision and dental and sort of like physical therapy, all these things are like sort of add-ons, and dental insurance isn't considered health insurance. So you got to go out and look for that. Vision insurance, same thing. So if you wear glasses and you don't want to pay a ton out of pocket, well, you got to go get those things, right? Now, let's get back to your deductible. So deductible, again, concept is low if you're going to use the system a lot, high if you don't anticipate using the system a lot, because that way you keep your monthly premium low. That's the payment you're making every month. Now, a lot of insurance companies make you pay a copay. That copay is going to be different. It's typically located on the back of your card. Copay is like, hey, I go to my doctor for just a routine checkup. Sometimes routine well visits are free. Sometimes they're not. It can be $20, $40, but that fee you're going to pay no matter what, right? That's regardless of what happens. And that's a little carrot on a stick for the doctor's office to sort of take your insurance, is you get a copay. That copay, sometimes some insurances may have a maximum amount of copay you pay. Majority of them don't. So you got to know that up front. Like, am I paying $50 per visit? Hell, am I paying $100 per visit? Like, that could cost you a lot. Now, those copays, you're going to be expected to pay those every single time. That helps sort of fund a little bit of the expenses for the doctors, because for their offices, there's a whole machinery that needs to take place. They need to do their note, they need to check their note, they need to bill correctly for the note, they need to submit it to the insurance. The insurance typically does a review, and then majority of insurances like to play a game where if it's something esoteric, they will kick back that thing, and then so the doctor might be running 7 months behind on actually getting the payment from you, right? And then some folks play this game where they overbill because they know the insurance isn't going to pay. Like, that's the only way to get them to pay the correct amount is to overbill. It's a really stupid game and I hate it, but you got to know how to play it, because health insurance is a big expense early, like not necessarily early in your life, but later in your life. As you start to accumulate more medical problems, hypertension, GERD, low back pain, hyperlipidemia, headaches, migraines, whatever it is, like, you're going to interact more as you age with the healthcare system, and your drugs can be expensive, the ancillary care can be expensive. So you got to know how much you're going to be paying out of pocket. Health insurance and healthcare is a significant expense in retirement, so you have to know what you're looking for. Now, there's ways for people to sort of get some tax breaks from health insurance. The major one that everyone likes to talk about, because it can be a forced saving vehicle as well as something to use in retirement, is your healthcare savings account. Now, not everyone is, I love those things, but not everyone is eligible to get one, right? It has an income limit on it. If you're a surgeon, you're a high income worker, you're not eligible for it. The other thing is, if you have to have a high deductible plan. The whole goal with the health and care insurance or savings account is that you can use pre-tax dollars to pay for your health sort of expenses, but it requires a high deductible plan. So right off the bat, one of the things I told you is, hey, this account like is going to be used to pay for my health, like my rare health insurance needs. But if you're constantly using the system, that $7,500 is going to be gone quickly. Now, if you're going to get a HSA and it's the same amount as your deductible, guess what? And you have to use the system a lot, that HSA is really, all you're doing is paying your health insurance with pre-tax dollars. And I would tell you right up front, you're better off just getting a low deductible plan and paying up front, right? Because then you're not really using it. But some people early on can use a HSA in parallel to like a Roth IRA and really get a lot of benefit and have a ton of money saved up by the time that they need to really truly interact with the healthcare system. There are other things like a FSA, right? And those things aren't really the same, right? It's a lower amount. It has a lot of stipulations. You got to submit receipts. Like that can get audited, and there's a very specific things that you can use that for. Now, those things aren't really, like, your employer provides some of that benefit, so you have to know the difference. But HSAs are great, but not everyone can use them. I really wish that they would increase the income requirement so that more Americans can use it. But at the rate that, or the level that it's set at, there's a significant amount of people that can use it. Unfortunately, a lot of people these days have more and more health problems, so it doesn't become a benefit. So it's a small subset of people that get the benefit from it. Now, understanding what the difference between a HMO, like your healthcare managed organization, versus like a PPO, and you can think of that as the difference between, hey, I have to go and talk to a gatekeeper who then directs the traffic on where I need to go, right? So that's like largely referral based. I go to my family medicine doc or provider, MP, whoever, and then they give me a referral, and I need that referral before I can go see an orthopedic doc. I need them to be like the gatekeeper and the check in a box on, let them get first crack at it. Insurance companies love that because, one, it decreases the cost on them because specialists tend to order the test that they need specifically, and they'll bypass a bunch of smaller tests that won't really provide them the answer right away, because their whole goal is to get you to the procedure. Like for a general surgeon doesn't make money in clinic because those workups really don't matter as much as doing the surgery, right? That's where they make the bank. Same thing with orthopedics, same thing with neurosurgery. So like the more time they spend in clinic, the less time they're making money for the hospital. But the insurance company loves that stuff because it doesn't cost them as much. Now, a PPO is like, hey, I don't want you telling me who I get to see at any point in time, right? These are your preferred provider organizations, right? Like, so as a surgeon, I have these negotiations with the insurance company, and I have a list of insurances, and I show up on their website, and a patient can just go, hey, I think I have gallbladder problems, or I was told I have gallbladder problems. I want to go find a surgeon who can take this out. So then they go to their insurance company website, and then my name or someone else's name is there, and then they can show up to that. They can make an appointment without needing a referral. Now that's important too, because insurance companies which have those types of things, typically they've already negotiated a fee, and so having a lower fee is a way for surgeons to get patients, right? Because the insurance company is the one that sort of gobbles up all the customers, all the patients, and surgeons and family medicine, internal medicine docs, they don't control any of that, right? And so their customer really is the insurance company, because that's who's going to pay them. The patients have to go through the insurance company, so the insurance company becomes a gatekeeping mechanism there. Now, understanding these things are important, because if you go to an out-of-network provider, that expense is going to hurt, right? Because they are charging way more, and it's sort of like a pain point to get you to use the providers they already sort of negotiated with, so that you don't utilize the system. So let's go through one scenario. If you're a family of 4 and you have young kids, and you know that they're just doing a bunch of pediatric visits, and you're relatively healthy, then yeah, you know, majority of those pediatric visits are covered, right? Those are just well child visits. Hopefully they don't need like an appendectomy or anything like that. So you can get in some scenarios, if you're super healthy, you might be able to do the high deductible plan with the HSA. That might work. However, a lot of people are just going to need a low deductible plan and pay the premium, which can be significant, by the way. So that way they don't have to worry about it. So if you have a broken arm and things that kids do, that it doesn't cost you an arm and a leg, right? Now, if you are a young, healthy individual and don't have many medical problems, the answer is like pretty flat out. Like, it doesn't matter if you get an HMO or PPO. Go with the low deductible plan and an HSA. If you are young but you have health problems, guess what? You're going to want a PPO, right? Because you don't want to have to wait for referrals, and you're going to want a low deductible plan, right? Because you know that you have to use the system, and you don't want to have emergency surgery or something like that and then get stuck with an extreme bill, like your deductible is $15,000 or whatever. Like, you don't want that to happen. Now, if you're young, you just got married, you don't have any kids, you need to pick a plan that's going to provide you some obstetrical coverage. Whether or not you're deciding to have kids now, 5 years from now, just get it, right? Because you don't want to be stuck. Like, those bills can be significant. I'm talking like $25,000, $50,000, depending on if there's a NICU stay in. Like, get the obstetrical coverage, okay? The other thing is, don't forget to get dental insurance. That comes on you got to go through a separate company. Sometimes your health insurance company will offer it, but sometimes you got to get it from a separate company. Don't forget to get vision insurance. You need to check these things. You don't take care of your teeth, you can end up with cardiac disease, and then all of a sudden, now it's actually bothering your health insurance. Like, all these things are a package, and I wish there was an insurance company that packaged them all together and paid, and you only got one fee. But unfortunately, that's not the scenario that we're in. There's probably some that I don't know, but just know majority of people are paying individual companies for these things. That's probably a business opportunity, to be honest. So with that being said, health insurance is simple but complex in our system. Your whole goal should be to allow the insurance to kick in as soon as you need it and not have to break the bank, because health insurance can bankrupt you, and you don't want to allow it to bankrupt you. If you know you're going to need a bunch of specialists, pick a PPO. If you don't mind waiting for a referral, pick a HMO. But nonetheless, health insurance shouldn't be scary. You can navigate this. I hope everybody's doing well. Again, thank you for rocking with me. This is Dr. David Roney. I really appreciate everyone. Thanks so much for being there and supporting me on this journey. If we hit 500 views, I would hire someone to manage all this stuff, because I suck at it. I don't have enough time, so I do the bare minimum, unfortunately. But I'm going to do better, right? I will do better. I hope everybody's doing well. Follow me on Twitter at FISURGI. or Phi Surgery, aka Surgify. Don't ask me why the name on Twitter is weird, but I digress. Thanks everyone and have a blessed day. Peace.